If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is diabetes? What may it causes? Answer by Richa Binani. Diabetes mellitus, is classed as a metabolism disorder. Metabolism refers to the way our bodies use digested food for energy and growth. Most of what we eat is broken down into glucose. Fasting blood test in glucose is a form of sugar in the blood. It is the principal source of fuel for our bodies. When our food is digested, the glucose makes its way into our bloodstream. Our cells use the glucose for energy and growth. However, glucose cannot enter our cells without insulin being present. Insulin makes it possible for our cells to take in the glucose. Insulin was a hormone that is produced by the pancreas. After eating, the pancreas automatically releases an adequate quantity of insulin to move the glucose present in our blood into the cells. As soon as glucose enters the cell's blood, glucose levels drop. Causes: overweight, obesity, and physical inactivity. You are more likely to develop type 2 diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel disease. To see if your weight puts you at risk for type 2 diabetes, check out these body mass index (BMI) charts. Insulin resistance. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. At first, the pancreas makes more insulin to keep up with the added demand. Over time, the pancreas can't make enough insulin, and blood glucose levels rise. Genes and family history. As in type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. The disease tends to run in families and occurs more often in these racial/ethnic groups. Answer by Prem Prakash Gupta. What is diabetes mellitus? It is a state of chronic hyperglycemia, high blood glucose/sugar level, with or without glycosuria caused by either relative or absolute deficiency of insulin. Types of diabetes mellitus and causes. It is mainly of two types. Type 1 diabetes mellitus, also known as insulin-dependent DM, IDDM, or juvenile onset DM. It is seen in childhood. It results from absolute deficiency of insulin due to destruction of beta cells. 2. Type 2 diabetes mellitus, also known as non-insulin dependent DM, NIDM, or maturity onset DM. It is seen in middle-aged persons/adults, greater than 40 years. It results from either relative deficiency of insulin, due to dysfunction of beta cells, or insulin resistance. It most common type of diabetes. Affect than type 1 and 2 diabetes mellitus. The other reasons for high blood sugar level, secondary diabetes mellitus, are, in diabetic patients, the uncontrolled blood sugar level causes chronic complications or later long-term complications of uncontrolled diabetes mellitus are nephropathy, retinopathy, neuropathy, CHD, gangrene, diabetic foot. Wish you non-diabetic healthy life. Answer by Suksan Jeevaneev. Diabetes mellitus is a group of metabolic diseases in which a person experiences high blood glucose levels either because the body produces inadequate insulin, harmony, or the body cells do not respond properly to the insulin produced by the body. Hyperglycemia, or raised blood sugar, is a common effect of uncontrolled diabetes and over time leads to serious damage to many of the body's systems, especially the nerves and blood vessels. There are two types of diabetes. Type 1 diabetes. Type 1 diabetes, previously known as insulin-dependent, juvenile or childhood onset, is characterized by deficient insulin production and requires daily administration of insulin. The cause of type 1 diabetes is not known and it is not preventable with current knowledge. Symptoms include excessive excretion of urine, polyuria, thirst, polydipsia, constant hunger, weight loss, vision changes, and fatigue. These symptoms may occur suddenly. Type 2 diabetes. Type 2 diabetes, formerly called non-insulin dependent, or adult onset, results from the body's ineffective use of insulin. Type 2 diabetes comprises the majority of people with diabetes around the world, and is largely the result of excess body weight and physical inactivity. Symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset, once complications have already arisen. Until recently, this type of diabetes was seen only in adults, but it is now also occurring increasingly frequently in children. Gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose values above normal but below those diagnostic of diabetes, occurring during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. They and their children are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening, rather than through reported symptoms. Impaired glucose tolerance and impaired fasting glycemia. Impaired glucose tolerance, IGT, and impaired fasting glycemia, IFG, are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. The causes of diabetes. Diabetes causes vary depending on your genetic makeup, family history, ethnicity, health and environmental factors. It also depends on our food. Some people eat a food in which the lack of insulin harmony. The perfect causes of the diabetes is not discovered. There is no common diabetes cause that fits every type of diabetes. The reason there is no defined diabetes cause is because the causes of diabetes vary depending on the individual and the type. Causes of type 1 diabetes. Type 1 diabetes is caused by the immune system destroying the cells in the pancreas that make insulin. This causes diabetes by leaving the body without enough insulin to function normally. This is called an autoimmune reaction, or autoimmune cause, because the body is attacking itself. There is no specific diabetes causes, but the following triggers may be involved. Causes of type 2 diabetes. Type 2 diabetes causes are usually multifactorial, more than one diabetes cause is involved. Often, the most overwhelming factor is a family history of type 2 diabetes. This is the most likely type 2 diabetes cause. There are a variety of risk factors for type 2 diabetes, any or all of which increase the chances of developing the condition. These include